Hey guys, today I'm going to talk about doctors' handwriting. This is honestly something I get asked probably second most often by the patients at my pharmacy. The first common question I get asked is probably, is this medicine going to be covered? But every once in a while, the patients will ask me almost as like a joke, like, how do you honestly read the doctor's handwriting? Did you take a course in university to read this handwriting? So I have no clue what he wrote. So, you know, a lot of times, I just smile and go, no, 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 we don't take a course. But honestly, how we really read doctor's handwriting um, is really from experience. So when I was a student, everything we study is from a textbook, so everything is written out nicely. But during internship, when you're actually working in a pharmacy, you really notice the difference between computer-generated prescriptions, where the words are spelled out properly, versus prescriptions that are written by hand by the doctors. So initially, as an intern, I gotta say the first probably a month, 2 months, I was actually really nervous, really even maybe a little bit anxious when there was a patient at the pharmacy drop-off counter handing me a prescription, because in the back of my head I'm like thinking, I'm like doubting myself. I'm not gonna understand what the doctors write. Oh, sorry, what the doctors wrote. I'm gonna look stupid. I'm gonna look unprofessional in front of patients. Like, how could I be a pharmacist and not be able to even read what the doctor wrote? But that's why I guess that's what internship's for. Internship for those 3 months, you kind of get used to, I would say, how doctors write prescriptions. And a lot of times, like, I even surprise myself because sometimes my pharmacy technicians, there's some stuff that they can't read. Even full-time technicians that have been maybe working for the company for 10 years, they would not be able to read what the doctor wrote. Like, they would drop off prescription, and she would be like, "What is this? I can't understand it." Then sometimes I would look at it and be like, honestly, I think it's that medicine. It looks like it. And then, of course, I would talk to the patients, ask them, why did the doctor prescribe this? What are you using this for? And then they would say, oh, I'm using it for, this lung infection I have. I'm like, oh yeah, it is for that. It must be that because that medicine is used for a chest infection or a lung infection. So basically, the gist of it is we do not take a course in university on how to read doctors' handwriting. We learn by experience. I think like most things in life, to do it well, you really need that real life experience. Once you get used to seeing a medicine written a certain way, many times, the doctor may not even have to write it properly. You would just sort of subconsciously, I don't know how you do it sometimes. Like I said, I even surprise myself sometimes. You just know it's that medicine. That's the difference between a pharmacist that may have been working for 20 years and a new pharmacist that's been working for like a year. Your experience from working in the pharmacy goes a long way in interpreting what the doctor has wrote. And of course, there are some prescription that's just like written totally, I wouldn't say wrong, but totally not spelled the way the drug is spelled. But those cases are generally rare and few. I think maybe if you hand me a prescription, like in the course of a year, there might be honestly two, maybe three prescriptions I'm not able to read and understand what the doctor wrote. And generally, honestly, most of those time, that prescription is from like a specialist. Like the specialists are doctors that specialize in a particular condition, and generally from very, not very, but like some of the older doctors. The newer doctors have seemed to embrace the electronic format of generating prescriptions. So most of the time that's actually typed out and spelled out for you, and all the doctor does is basically sign the bottom, verifying it's like a legitimate prescription. But yeah, so reading doctor's handwriting, totally from experience, no university course taken on how to interpret writing, just from seeing things often. You develop the basically honestly, I just think subconsciously, like once you know the medicine in your head, like it's the medicine is in your head. So when something is on prescription, that's sort of close to what the medicine is in your head. You just put two and two together, and you just you have that confidence. So internship, very scary for me. People drop off prescription, be like, oh my god, I hope I can read it, or I hope like the prescription is not writing like a really weird way. But now, no problems at all. 5 years later, no problems. Reading prescriptions is like reading texting a book. Very very easy. Okay, all right, that's it for this time. See you next time.